Hi, I'm Robin Brumble, the Director of Scientific Affairs and Research at CLL Society. And it is hard to believe that we are already in our second year of CLL Society's research program. And we have many exciting things on the horizon. Today, I would like to introduce to you the winner of our 2023 Young Investigator Award, Dr. Andres Chang. And he will be receiving a $150,000 research grant from CLL Society that will be distributed over the term of 3 years, in which he will be running his research project. So, Dr. Chang, will you please introduce yourself? Tell us where you're from and what your role is.
Sure, thank you, Robin. So my name is Andres Chang. I'm currently an instructor at the Winship Cancer Institute of Emory University. I'm originally from Guatemala and immigrated to the United States for college and did all my postgraduate work in the US, first at the University of Kentucky, where I got my MD PhD. And then I came to Emory University, where I did my internal medicine and hematology and medical oncology training. I stayed on here as faculty, again, holding an instructor position, and my clinical and scientific interest has been to study the immune responses in patients with CLL. My mentors are Dr. Chris Flowers, who was at Emory at the beginning and now is at the MD Anderson Cancer Center, Dr. Jonathan Cohen, who is still at Emory, and then Dr. Rafi Ahmed, who is an immunologist here at Emory University as well.
Wow, that's great. Well, the name of your research proposal is Adaptive Immune Responses in CLL. So let's start by discussing what exactly is the adaptive immune response.
Sure. So the immune system is divided into two main categories: the innate immune system and the adaptive immune system. The innate immune system is a system where our cells are pre-programmed to recognize certain patterns that bacteria and viruses have, so that they can act rapidly based on pattern recognition. The adaptive immune system, on the other hand, is the branch of our immune system that learns and remembers how to recognize specific pathogens, specific viruses and bacteria, so that they can in the future, do a better job at protecting us from those particular pathogens that we encounter. It is divided into B cells and T cells. B cells make a special tag against these pathogens called antibodies. And then T cells help B cells make those tags and also perform the killing component of the adaptive immune system.
And of course, the killing part of the immune system would be to kill off viruses.
To kill off the viruses and the bacteria and the cells that make those viruses as well.
Okay, great. We know that CLL is a cancer of the B cells. You mentioned the B cells. And we often talk about how those who are living with CLL or SLL are considered moderately to severely immunocompromised, regardless of whether or not they are currently receiving treatment. So can you talk a little bit about why that is? Why are specifically, why are those with CLL or SLL considered immunocompromised?
So all patients who have cancers arising from the adaptive immune system are considered moderately to severely immunocompromised, and that is especially true for CLL. And I think that's because cancer cells retain their ability to send signals and receive signals from other immune cells, and often these signals prevent the other parts of the immune systems to work well. Many of the treatments that our patients receive also affect the non-cancerous immune cells. And so the combination of the cancer cells doing sending abnormal signals and the treatments that we give to patients can affect and lead to a compromised immune system. Now that said, which precise signals and what other factors combine to generate the dysfunctional immune system that we see in patients with CLL is really not well understood. And without this knowledge, we really cannot devise ways to treat and reverse this immune dysfunction. And so more research is really needed to understand why patients with CLL have this immunocompromised state.
Really important. Well, we've known for a long time that one of the main causes of mortality for those with CLL is infection. And there has always been an emphasis on with our patients getting all of the recommended vaccines like shingles, pneumonia, influenza, et cetera. And we've always stressed getting your vaccines early in the disease, and especially before you then start any treatments. But really before the COVID-19 pandemic, while the infection that we were most concerned about being potentially deadly was pneumonia, we didn't really recommend everyone with CLL get checked to see how well they responded to their vaccines or to wear masks to help protect them against infections. So can you talk a little bit about how the pandemic has really changed things in terms of shining a sort of a spotlight on the increased infection risks and impaired vaccine responses, specifically in those with CLL or SLL?
Yeah, so the COVID pandemic has really opened the eyes of the scientific community and the public in general about the seriousness of this problem for our patients. Well, you're right that we knew for a long time that CLL patients were more prone to infections and so forth. Very few really attempted to quantify the magnitude of the problem or try to even address this problem before. And the focus was really in other areas in terms of CLL. And as bad as the COVID pandemic is, COVID has really put the spotlight on this issue and provided the whole scientific community of a unique opportunity to get a better understanding of this problem, partly because we see on a day-to-day basis how patients with CLL were doing much worse from COVID infections, but also because now we have a new virus, we have the right tools in the laboratory, we have the right clinical settings, with a clinical infrastructure, with new vaccines, new assays, new technologies, and with the spotlight being on the increased mortality in our patient population, funding also came to try to study this better. We have, since the beginning of the pandemic, we have gained a lot of knowledge about the degree of immune dysfunction that we see in CLL patients. And that's particularly true when it comes to quantifying how much antibody our patients produce. And so after either infection or vaccination. But our understanding of the mechanisms of why this happens is still very poor, which is why I'm interested in studying this. My goal is really to get a better understanding of this process at the cellular level so that we can hopefully find better ways to reverse this immune suppression in the future.
That's really important. So you touched a little bit on it, but let's talk about your research project itself. Can you go a little deeper into what it is exactly that you are going to be doing with this project?
Sure. So as I previously mentioned, there have been several reports that have shown that patients with CLL, regardless of whether they receive treatment or not, produce fewer antibodies after COVID vaccination. I have previously published a couple of those papers as well. We observed that even though patients with CLL in general produce fewer antibodies, some patients actually produce more antibodies than others. And some actually do not make any antibodies at all. We know that patients who receive certain treatments might be more predisposed to making less antibody, but that's not the full story because, as I mentioned before, some patients some CLL patients who have never received any treatment, they still produce fewer antibodies than others. And so what I'm trying to do is to understand why the non-CLL B cells, the ones that are supposed to make these antibodies, are not working as well in our patient population, what factors lead them to make less antibodies. And I'll be conducting several of these experiments to try to measure and characterize these specific cell population that gets produced and is supposed to recognize the COVID protein encoded by these vaccines. And I'll study them over time and compare them to similar cells that are found in other people without CLL to see what kind of factors are different that might make them, at the end, produce less antibodies.
Well, that's a great segue into me kind of posing the question to you. I was going to ask, why your research is so important for those with CLL and SLL and kind of what you hope to gain. But I think you touched on that a little bit in that you are really looking at the COVID responses right now, but we're hoping that you can use what you find and sort of translate it into other things besides COVID. Is that correct?
Yes, yes. So I believe that my research will give us very important information that can help us understand why CLL patients make lower antibodies, not just against the COVID vaccine, but against some other vaccines. As you mentioned earlier, we stress the fact that we need to vaccinate against influenza, against shingles, against pneumonia. The RSV vaccine is coming up. And so this kind of information is really essential and is needed before the scientific community can start thinking about new ways and improve methods to induce better immune responses in CLL patients, eventually protecting them from infections. And I say infections broadly, again, because I'm not thinking that this is just COVID specific, but I'm using COVID rather as a tool to understand the broader process better so that we can design better methods later on to prevent against all infections. The other important thing too is that by studying how these non-malignant or non-CLL B cells behave, it can also help us understand why some CLL patients also develop some autoimmune complications like low blood counts and things like that, for example. And if we understand those processes better, which we don't right now, then we could potentially also address those problems by designing potential new mechanisms to prevent those from happening.
Excellent. Well, that is a great overview of what you hope to achieve. So we're really excited about this, Dr. Chang. Well, do you have anything else to add or any final thoughts as we close?
Well, I just first of all, I really want to thank the CLL Society for giving me the opportunity and for recognizing the value of my research to dedicate this amount of funding to this cause. I want to also thank my mentors and more importantly to all the CLL patients that are coming to our clinics and are volunteering to donate blood and to donate their clinical information so that we can conduct this kind of research. I encourage everybody that are not involved in research to consider getting involved because really everything starts with patient participation, and without our patients, we cannot do any of this.
Absolutely. Well, thank you so much for your time today, and we are super excited to hear what you find over the years, and we will provide an update as things develop. And I just encourage everyone to stay tuned to the research section of our website as we are growing the number of researchers that we are funding, and there will be some exciting new updates soon. So thank you for your time today, Dr. Chang.
Thank you very much, Robin.